I'm not aware anybody on my side of this issue has politicized it. The accusation is always that we're not. You did state, by the way, 10,000 lives saved in Hawaii. I would love to have your citation on that. So if you can give us a study so we can put that in the record. And any other citation, give us on the millions of lives saved by vaccines as well. I mean, again, I want to know the truth. Just real quick, I've got a couple other charts I want to put up there. This is a chart a lot of people produced it.
Chairman, if I could just interrupt for 10 seconds over here.
Sure.
Is today's just a point of order? Are we talking about vaccines or are we talking about the COVID vaccine?
Well, specifically, we were talking about the hiding of the safety signal on myocarditis.
So we're not talking about all vaccines?
We can talk about anything you want to.
Okay.
I mean, again, it has obviously opened up because we're also talking about the corruption of science. And I think science has been corrupted. So fair game. So, and again, I appreciate you staying here and stick around and ask a lot of questions. I think you'll learn an awful lot. Put my time back on the clock. No, I'll take whatever I want. This is a chart. This is a chart. Again, I was looking at the VAERS. You know, I had been.
Mr. Chairman, that's not the way I ran this subcommittee.
I had been. Well, this is a different. Again, I'll be very generous. Okay. I was actually instructed as a non-doctor what the COVID injections were. Encapsulated lipid nanoparticle that was designed to permeate difficult to permeate barriers. So they lied to us when they said they'd stay in the arm. They knew it wouldn't. They had a study. The Japanese regulators uncovered that when they did do a biodistribution study in rats, it distributed all over the body. So that was the first lie. Didn't really talk too much about the toxicity yet of the lipid nanoparticle, but it goes all over the body. So I was aware, and again, that this was not a standard vaccine. This isn't a attenuated or dead virus that the body reacts to. This actually hijacks the cell, has the cell produce the spike protein, which is toxic to the body, which means the body attacks it. Again, I'm a layman, but it's pretty simple for me to understand this. So I was aware of this like in October. So I'm watching VAERS, and so I'm publishing these charts, and I'm being censored. I see the next chart, chart number 2. This is the full history of VAERS and the number of deaths being reported associated with the vaccine. You got a couple hundred a year until 2021, and yikes, 21,725 deaths worldwide. Why? And everybody's saying, "Oh, this is safe and effective." The vaccine injured were being gaslit. They weren't being treated. They're still being gaslit. There is no, by the way, there is no compassion, Governor. I could fill this room with photos of people who are dead because of the COVID injection. I could fill the room. And that is being denied. That is being denied. It is being denied. And these people haven't been able to get help. I held an event in Milwaukee in June 2019 and 2021, and all the vaccine injured, those women, all they wanted was to be seen and heard and believed, and they are not to this day. Okay? So again, they're not the ones politicizing. They just want to be helped. They want compassionate doctors to treat them, to recognize what caused their illness, not gaslight them, not deny that it exists. But anyway, so you take a look at this chart, and they're still denying that this, nothing to see here. This is safe and this is effective. Okay? Next chart. This is the current VAERS chart. 38,607 deaths reported worldwide associated with the COVID injection. And we know VAERS dramatically understates, by a factor of 10, 100? We know it understates it. 9,228 of those deaths are occurring on the day of vaccination, the 1 or 2 days. Okay, I know VAERS doesn't prove causation, but man, that's a correlation we should have been looking at, but they ignored and they censored. But enough of that. Dr. McCullough, please, in my layman's terms, I just kind of laid out the harmful mechanisms of this injection. Can you and Dr. Vaughn, because I think you've both spoken to this, again, in layman's terms, talk about why this caused so much harm in so many different ways because of the biodistribution. Dr. McCullough.
80% of Americans took a vaccine. 20% didn't. 20% did not take a vaccine. The vaccine was never safe enough for me to take. Messenger RNA, devised by Pfizer and Moderna, has been chemically modified to be unassailable to enzymes in the body to be broken down. The messenger RNA is found in the human heart of people who die after the vaccine. It's found in the brain. The spike protein is found everywhere in the body. 3 studies now show the spike protein is circulating in the blood for 6 to 9 months after people take the shot. This part of the virus, the lethal part of the virus in the vaccinated, it's circulating in the blood. And then they take a booster, they get more circulating in the blood. It is a killer protein. It cannot be safe. It was not safe by design. Safety trumps efficacy. We cannot tolerate false drug claims. And we saw a poster behind Senator Blumenthal making a false drug claim that vaccines saved millions of lives, specifically the COVID vaccine. Well, let's take a look at that. When someone signs consent for a vaccine, Senator Blumenthal, does the consent form say it's going to save their lives? Of course it doesn't. It's not on the FAQ. There's never been a prospective, randomized, double-blind, placebo-controlled trial ever showing that COVID-19 vaccines reduce mortality or hospitalization. There's not even a valid non-randomized study. Thankfully, COVID mortality went down for 3 reasons. Because we all got the infection, vaccinated and unvaccinated, so we developed population natural immunity. We developed early treatment. Credit to Operation Warp Speed. We used all the Operation Warp Speed tools, additional drugs. We treated patients with multi-drug protocols at home so they don't go to the ER. So Governor Green never saw the patients we treated because they were successfully treated at home. And the third reason is the virus mutated to a much milder form. Those things happen concurrently with rollout of the vaccine. The vaccine cannot be falsely credited with saving millions of lives. We can't allow false drug advertising to be put up on a poster behind one of our public servants. We cannot accept that.
So let me quick. And I will have a lot more. I will have a lot more questions. Put up my that optional chart number 4 here, because I think this is something I developed September 2021, and this shows the number of daily cases of COVID, and you see it's peaking in January. Right as we're rolling out the vaccine, but we really haven't injected it with anybody. If by the time we had any kind of significant uptake of the vaccines, we were way down in terms of the number of daily cases. I mean, this virus was burning itself out. Okay, now we had different variants. Again, I've read a lot of information about vaccination into the midst of a pandemic driving variants. Is that what happened? I don't know. But you would think if a vaccine were that effective, the tail would just continue and the pandemic would be over. But that's not what happened. We had a whole new surge, and this is Delta, and doctors I've talked to, a very deadly, probably a more deadly. Would you agree with that, Dr. McCullough? Delta was a more deadly. I know you guys are kind of freaking out that your early treatment wasn't working as well.
It was definitely more difficult to treat. But fortunately, by that time, we had treatments.
But anyway, I just wanted to put this thing up here again. Again, to a layman, if the vaccine really worked, was that efficacious, prevent all that disease? By the way, they all admitted that it didn't prevent transmission. They lied to us about that for months, if maybe a year.